Hello, my future dental assistants. This is Miss Denise. Today we're going to be talking about instrument transfer and maintaining the operating field. If you take your green books out, go to chapter 19, that is on page 412. So instrument transfer proper instrument transfer occurs when the operator's view remains on the oral cavity. The operator could be the dentist, the assistant, or the hygienist. You want them to not have to look up or look around for the next instrument that they need. If you have proper instrument transfer, less stress and fatigue, you'll have less stress and fatigue. You will be comfortable and you'll have some more safety if you are handling the instruments properly. And production is increased with less motion. I don't know why I can't talk today, guys. So production is the amount of money you will make during a procedure. So you have more production if you take less time to do the procedure. The transfer zone is the area just below the patient's nose near the chin. If you go to page 413, it talks about the transfer zone. And we also will talk about the fulcrum. The fulcrum is the point of rest on which fingers are stabilized and can pivot. For example, when you're working on the mandibular first molar, the fingers rest on the occlusal surface of the mandibular bicuspids, providing the fulcrum. The tactile sensation is the feeling sensed by touch. So, for example, the pressure of the instrument exchanged during an instrument transfer is the tactile sensation. And some of you pointed out this fact already. You want to make sure when you're handing the instrument over, you do it firmly, but not too hard, just so where the operator can feel it being put in their hands. The transfer hands, or the assistant passes and receives instruments with the left hand while working with a right-handed dentist. So if you remember, I always try to get you to pass the instruments with the left hand. Now, if you're working with a left-handed dentist, you're going to use your right hand. Some of the instrument grasps we use are, one is called the pin grasp and one is called the modified pin. If you go to page 414, you can see some more photos of that. So with the pin grasp, you'd most likely be working with the instrument in the patient's mouth and also the modified pin grasp. Then you have the palm grasp and the palm thumb. The palm grasp if you're holding a clamp, and then the palm thumb if you're holding like a chisel type instrument. Then you also have the reverse palm thumb. If you go to page 415, there's a picture of that. That is how you can mostly hold the suction. There's different ways of holding it, of course, but you do the most comfortable. But the most common is the reverse palm thumb. Now there's 8 basic instrument transfer methods, and that starts on page 415. Number 1 is the primary working end should be placed away from the assistant on the tray. Number 2, with straight shank instruments, the primary working end should be placed toward the instrument. So the working end is the part of the instrument that you're going to be using in the patient's mouth. Now with hinged instruments, beaks are placed toward the instrument. If you go on page 416, this continues here. So with hinged instruments, the beaks are placed towards the assistant. So you hand the operator where he or she can grab it, and the beak is facing you. You hold the instrument between your thumb and index finger and middle finger. With the pin grasp instrument, pick up the instrument from the tray near the end closest to the assistant. And the assistant's hand is placed on the instrument opposite from end operator uses. So you put your hand on the instrument on the opposite side from where the operator uses. Now rotate working end of the instrument until it is directed toward the dental arch being treated. So you want to make sure it's parallel to the instrument is passed parallel to the operator. Now there's different transfer methods. You have your one-handed transfer and your two-handed transfer. And that would be on page, I passed it up. it starts to, oh, it's on page 416. So the one-handed transfer is the most common transfer. Excuse me. It saves time and allows the assistant to use the evacuator or the air-water syringe at the same time. Now the two-handed transfer, the assistant uses both hands. One hand receives the instrument from the operator and the other passes the next instrument. This transfer is used most commonly for surgical forceps or when both hands are free. So, what grasp would you use when using a Wiedelstedt? Now, that is a hard word to pronounce. So, you would use the palm thumb grasp. Trying to see where this is in the book. So, let's look it up in the index like we did when we were ordering supplies. So the best way to explain that is, of course, it's not in the book here. Anyway, I believe that is a oral surgeon, an instrument an oral surgeon uses. So what grasp would you use when using a Wiedelstedt? That is a palm thumb grasp. A Wiedelstedt is a like a chisel and it's straight and you can use it during oral surgery, etc. Excuse me. Now there's instrument transfer modifications. You have the mirror and explorer transfer, and we are on page 418. Then you have the cotton pliers transfer. And you can just look at the pictures. You have the scissors transfer, the dental handpiece, the air-water syringe transfer. As you can see, the assistant is holding it so the operator can grasp the handle. You want to maintain the lighting. You want to make sure it's conducive to where the doctor can see it. You want to illuminate the oral cavity. In here, we're talking about the evacuation system. That is on page 422. So evacuation is used to remove water, saliva, blood, and debris. You have the hose, the evacuation tip, and the handle, your grasps, and placement. Here are some placement examples, and you can look on page 423 in your book, and it'll show. So that's the upper, which is also called the maxillary, to the left, and then to the right is, so on the left was a posterior tooth in the back. This is also posterior, so it'll show you where to put it. Then you have the at the bottom, so the mandibular, also the bottom. Here is the anterior tooth placement. So you would put your evacuator tip on the top when the operator is working underneath. And then same for the bottom. You would just reverse it. So if the doctor's at the top, you'd be in the back. So the saliva ejector, I'm sure some of you have seen that. It's for the removal of saliva. The air-water syringe, it emits water, air, or a combination of both. So if you press the buttons at the same time, it gives a strong water-air emission, and it's mostly used to clean the teeth. It rinses the mouth, and if the patient has some dry areas, you can moisturize it with the air-water syringe. You need to retract tissues to increase the visual field, so you retract the the cheek, the tongue, the lips, and you use the mouth mirror for that. You can also use mouth props and gauze. Then the isolate system, lots of dentists have been using that lately with the COVID. It's a system to maintain a clear, dry field for the operator. It provides isolation, retraction, evacuation, and a light source as well. You also have your techniques for the moisture control and isolation. We are moving on to page 427, 426, and 427. Cotton rolls. Cotton rolls are used to suck up the moisture, and also they come in various shapes and sizes. It isolates the area. You can rest your HBE on it. That helps with that, so you won't suck up the cheek or the lip. To place materials. And we also use it as something on which the patient can bite. If we're cementing a crown, we'll have the patient bite on a cotton roll to seat the crown more. All right. Now we have something called a triangle. It's a triangular absorbent pad. It absorbs the flow of saliva and provides a surface for the cheek retraction also. So you put it in the corner of the mouth, and you can use your saliva ejector or your HBE to help retract the cheek. Now, an expanded function, I don't know if you've heard of that, but we have expanded duty dental assistants here. It's called the EDDA. In other states, they have expanded function. Now, the first thing talks about taking x-rays. If you go pay $20 to financial aid when you're ready, you can take the test to be x-ray certified, and doctor requires their assistants to be x-ray certified. And we will be learning again a little bit more how to position the x-rays and take x-rays. Placing and removing a rubber dam, that's another isolation device, and that's going to be in this chapter as well, and that starts on like page 430. Corona polishing is when the hygienist polishes your teeth after he or she scales them, after she or he uses the instruments to take the tartar buildup off. They'll polish them and make them nice and shiny. Taking study model impressions. Those are impressions that you take and pour up and you mount on an articulator so that the doctor can plan the patient's next procedures. Placing sealants. Sealants are, it's like a flowable composite that's used on young adults, mostly when young adults have deep indentations in their molars on the occlusal surfaces. Sometimes they're more prone to decay, or caries we call it. You place a sealant there and you harden it, and it seals the teeth to prevent bacteria from getting in. A provisional is temporary bridge or crown. You can also place a base or a liner. If you remember us learning how to mix IRM, that's a base. That's some things we do. Taking photographs, we can take intraoral photographs, which means inside of the mouth. Performing orthodontic procedures. If you work for an orthodontist, you're going to have to learn how to do all of that. Removing sutures. If you have an oral surgery site, you can remove the sutures. And placing periodontal dressings. That is after a patient has periodontal surgery, which is gum surgery. All right, we're going to stop right here, and I hope you guys learned something. Any questions, please message me or talk to me in the next lab.